actually here so that we can better how we practice in Ghana. So we are not here to pass judgment, but what this channel is looking for is for the advancement and better practice in our motherland, Africa, and especially Ghana. We want this channel to help restructure how medicine is practiced in Ghana. Doctors need to be trained or retrained or make to do more research. Nurses need to be retrained and actually teach them how to treat patients, because it's very understandable that it is really chaotic when you come to practice in our motherland, African, especially Ghana, that you have a lot of patients. That is absolutely true, but that doesn't mean that you should relent in studying or just prescribe anything. That a patient comes to you, you won't even listen. You start prescribing. You start writing medications. We need to do better. So here I am. We will be dealing with topic each week. And so if you have gone through the Ghana health system and you are a victim to any practice, drop a comment, because we're going to discuss. Here we are today. It is not to put judgment on anybody, but at the end of the day, that our health system in Ghana and especially Africa will be better. That our doctors will be careful, will be held accountable on everything they do. I know we are human, we can make mistakes, but there are certain mistakes that should not be tolerated in the health sector. So, if you are listening today, or you happen to chance on this channel, pass it on to any African country or any African or any Ghanaian or even to anybody at all, because the goal is to bring help as well to Ghana and Africa as a whole. So if you are listening to this channel, pass it on, because I want everybody to drop a comment. Whoever has been a victim, or you know somebody who has been a victim of the way Africa doctors and nurses do their practice back home, drop a comment. We are not here to judge anybody. You do not have to mention names, but we want to look at how better our health system can be in Africa, especially Ghana. And if there's any help out there that can go to Africa and Ghana and restructure the education system pertaining to medicine practice, so that nurses, doctors, if their syllabus or their courses that they take before they become doctors and nurses need to be rehauled or changed, that would be the best for our country. So join me. I know it's not going to be easy, but this is a passion that in your small corner, let's do this to bring some ripple effect and let there be a change in our sweet motherland, Ghana and Africa. So it's about gaining knowledge and not to pass judgment on anybody. So join me. But if anyone is out there that's tried everything and being let down, one thing I also want to assure you, that I have a Savior. He's also a healer. Jesus. Why don't you try him too? He can heal you. As we go through this journey together, maybe you will learn a lesson. You will learn a lot to make your life better, to make good choices. As we hope and pray for a restructure of the Ghana health system or Africa health system. Thank you, ladies. God bless you all.